Today we're going to talk about the three reasons a lot of Social Security checks are incorrect, or if you haven't filed yet, just might be incorrect. So we want to go through the list. We're talking about earnings record, timing. You filed for the wrong program. Life happens, so we'll talk about all those particular situations. And because Social Security has so many exceptions, the exceptions, each case is a little bit different. I do a live Q&A, which will start here pretty soon. Looks like I already got a lot of questions. So let's go ahead and go down the list and make sure your Social Security is correct. Make sure you subscribe and like and all that kind of good stuff. Okay, the number one thing that everybody should do, even if you're 20 years old or 30 years old, 40 years old, or 70 or 80, is to confirm your earnings record is correct. What is your earnings record? That's what Social Security has internally. And you can go on to SSA.gov, make a My Social Security account, which is always a good idea because it protects you. It's far more difficult from someone else to go in there and pretend to be you and start causing you trouble if you already have an account. So you go in there, and the number one thing is to check your earnings record. That is all the money you paid into Social Security over 20, 30, 35 years. Social Security determines your benefit amount by your high 35 years. So when you go in there, predominantly you're looking, based on my experience taking hundreds of thousands of retirement claims, 99% of the time it's usually a gap year. So if you know for sure you worked in 1990 and it shows zero earnings for 1990, you know something happened along the way. And the sooner you get that fixed, the easier it is. Because if you see a 0 year there and you're like, no, for sure I work, so I'll have to find my W-2s or your 1040 or whatever the case may be, and you take that down to the Social Security Administration and they check to confirm it. And usually, if it's somebody typed a Social Security number in wrong somewhere along the line, you or your accountant or the IRS somewhere, it's instead of your Social Security number being a 1-2, they transposed the numbers and made it a 2-1. And those earnings are out there in what's called a suspense file. They're just kind of hanging out there for someone to come and raise their hand and say, yep, these are my earnings, same name, same address, same employer as the year before, the year after. And the Social Security employee brings those records from the suspense file, sticks them in your record, and it's automatically recalculated. So if you're already receiving benefits and you correct your earnings record, then if you've been receiving your benefits for 5 years and you were entitled to an extra $10 or $20 a month, then they will give you that extra $10 or $28 a month for the last 5 years. And as I mentioned, it's the sooner you catch it, the better. This is why I recommend everybody. So all your young people out there, your nephews and nieces and sons and daughters, tax season is coming up. Tell them, says, okay, did you do your taxes? Fun stuff, right? Yeah, we love paying taxes, but you're not done yet. A few weeks after you file your taxes, go into your Social Security account and confirm those earnings are there. Because I see a lot of times that, people 20, 30 years later go try to correct it and they don't have the documentation, and it's those earnings aren't in the suspense file. So you're going to be losing benefits the rest of your life, including your spouse and your surviving spouse. They will lose benefits for the rest of their life. So it's important that you fix it. All right. The timing when you start your Social Security benefits, regardless of what type of benefits we're talking about: retirement, spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, surviving spouse benefits, whatever the case may be. If you start those benefits at the wrong time for your particular situation, then your benefit amount is going to be possibly incorrect for the rest of your life. In terms of surviving benefits, the earliest you can collect surviving benefits is at 60 years old, unless you're disabled. If you're a disabled widow, then you can collect it from 50 to 59, but regular surviving spouse starts at 60. Regular retirement, spouse benefits, divorce spouse benefits start at 62, the earliest. If anytime you take money early from the Social Security Administration, it's reduced a little bit every month. It's reduced if you take those benefits early. And in most cases, disability, it's not reduced. And once you hit your full retirement age, then you're no longer reduced. You get your full benefit amount. And if you wait till after your full retirement age, you get these things called delayed retirement credits. It's 8% every year you wait past your full retirement age. So if your full retirement age is, let's say, 67 years old, and you wait till 70, that's 3 years. 3 times 8, 24%. So if your benefit is $1,000 at 67, you wait till 70, guess what? Your benefit for the rest of your life is $1,240. And the delayed retirement credits, your current spouse or your divorced spouse don't get those while you're still out there alive and kicking, but delayed retirement credits do go to surviving spouses. So that's another thing you need to take into consideration in terms of timing. And people ask me all the time, when should I start? Nobody can tell you when you should start your benefits unless they ask you a bunch of questions. Are you healthy? You got longevity in your family? Do you need the money? Is it a tax issue? Is it going to cost you more in taxes getting those extra benefits? Now we're starting to add the politics part of it, not because who's in the White House right now. That's been like this for a while. The Social Security Trust Fund is slowly running out, and we're looking at about 2033 or 2034 when we're all going to get 20% plus cuts across the board, unless we do something. So make sure you do something, reach out to your politicians and all the rest of it. Okay, let's talk about people filing for the wrong program. People think that Social Security is just Social Security cards and retirement. That's it. That's incorrect. You've got, retirement, you've got early retirement, delayed retirement credits, full retirement age, you've got spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits. Those are benefits that if you file for benefits on your own record, and if you were married to someone and that person is at least 62 years old, doesn't matter if they're receiving benefits, they're at least 62 years old, and you've been divorced for 2 years, you can start benefits on their record, regardless if they've been receiving benefits or not. And then there's surviving spouse benefits. And what I see quite often is, if all you have is a hammer, everything looks like a nail, right? People just, I'm going to go file for Social Security, and Social Security is retirement. So they go in there and they file for retirement benefits. And then a few years later, they come here and they say, wait a second, I shouldn't have filed for retirement. I should have filed for surviving spouse benefits first. Get the surviving spouse benefits, and then not touch my benefits on my own record and let my own benefits increase up until full retirement age or 70 years old. And so they've lost, probably hundreds of thousands of dollars throughout their life because they filed for the wrong program at the wrong time, or they forgot to, or they were misinformed about filing for divorced spouse benefits because, they thought the previous spouse had to be receiving benefits, which is incorrect, or they looked at the wrong numbers. I see this quite often. People file for spouse benefits and they file for benefits on their own record and they want to file for spouse benefits. But in order to get spouse benefits, if that person is still out there alive and kicking, your benefit amount has to be less than half of the other benefit amount. The full benefit amount. This is where people make the mistake. It's called the PIA, the primary insurance amount. That is the amount of your benefit at your full retirement age. What I see happening all the time is people look at the MBA, the monthly benefit amount, how much the person is actually receiving, how much they're receiving, how much their spouse is receiving, and they look at their own check, and then they look at their, the husband or wife and say, hey, Bob, hey, Karen, how much are you receiving? Oh, well, okay, well, mine's not less than half a year, so I guess I'm not entitled to benefits, so I'm not again call Social Security and sit on hold for 3 hours. You're losing money because you're not supposed to look at that number, how much your check is, because you might have filed early, or they might have filed early, or you might be having Medicare taken out or taxes taken out or something. You don't look at that number. You look at the primary insurance amount, the full benefit amount at your full retirement age to determine whether you're entitled to spouse benefits. So file for the right program. And another thing is disability. You can file for, somebody supported us, file $4.99. Thank you very much. It's been like Donkey Kong, okay, is the name of the person there. Thank you very much. I appreciate it. So people can file for disability benefits and retirement benefits at the same time. Why would you do that? If you're under your full retirement age, at least 62, 63, 64, up to 67, and you stop work because you're disabled, not able to work anymore, and you say, well, I'll go ahead and start my retirement benefits. Okay, fine. You can do that, but if you're truly disabled, Social Security defines disability as the inability to work, and for a disability that's going to last 12 months or longer, file for disability at the same time. File for disability because if you're like 62 and you're approved for disability, you get your Medicare like a year earlier. And people on receiving disability don't get a reduced amount. So if your disability starts at 62, your benefits are reduced by 30%, like early retirement. Why would you want to file for both? Because Social Security is grossly understaffed, and it takes 6 to 9 months if you're lucky to get approved for disability benefits. So people just can't, survive for 9 months without any money. So they go ahead and file for the disability benefits, and they start their retirement benefits, their early retirement, so they get a check. And then once their disability benefits are started, it's called dib after rib. So it is adjusted. So if you were taking your retirement benefits for 6 months, then your disability benefits are probably going to be adjusted down 6 months, but it's not going to be the years or so because you started at 62. So it's it depends when your onset date is, everything. But long story short, very complicated stories going short. If you're under your full retirement age and you're at least 62 years old and you want to go ahead and start your retirement because you can no longer work, filing for disability and retirement benefits. Definitely helps. Okay. So too many people file for the wrong program, and that includes Medicare. People file for Medicare when they shouldn't, when they have health insurance from work, theirs or their spouses, and their employer has 20 or more people in that group health plan. Then you do not have to sign up for Medicare. You do not have to contact Social Security, when you turn 65 and tell them you don't want it, unless you're already receiving benefits. If you're already receiving benefits, then Medicare will sign you up for Part A and Part B automatically once you hit 65, about 3 months before you hit 65. And then you have to find a plan, Medicare supplement plan, which the ones I recommend, an N or a G. But if that's not for you, then a Medicare Advantage, make sure if you get a supplement, you get a Part D plan. You can reach out to my partners there at Chapter. They provide free help on finding all the plans, and their sponsor our question and answers today. So reach out to them and they can help you all that. But don't waste your money if you don't need to. And, don't throw money away, because all this money is yours. You paid into FICA for all those decades, high 35 years, is that's how they calculate your benefits. You paid all that money. So your new job in retirement is to make sure you get all that money back as possible. And in terms of benefits as well, Medicare Part A and Part B and whatever. All right. Another thing that people are getting the wrong benefits is life happens. People don't realize that if your situation changes, you might be entitled to more benefits. As I said, if let's say you're receiving benefits on your own record, and then you have a spouse or a divorced spouse that passes away, then you just might be entitled to surviving spouse benefits on those record. And a mistake I see quite often is people check divorced spouse benefits and they say, hey, they call up Social Security and 10, 20 years ago, and see if there's any spouse benefits. And the Social Security employee looks at the PIA, the primary insurance amount, to see if your benefit amount is less than half of theirs. And they say, no, you're not entitled to benefits. They shouldn't say it like that. They should say, you're not entitled to benefits today, but that could change in the future. And changing in the future is maybe that person works a whole bunch more and their benefit amount goes up, and now you're entitled to some money on their record. Or that person passes away and you might be entitled to surviving spouse benefits. Or you were receiving here's a big one that happens is you're receiving surviving spouse benefits. You don't touch your benefits on your own record, and your benefit amount continues to increase. And at 70 years old, then your benefit on your own record is more. And people always ask me, well, will Social Security notify me? Yes. Will they change it automatically? No. It's called a WIB-RIB, Widow's Insurance Benefits to Retirement Insurance Benefits. And every Social Security office in the country is supposed to do this, but, being low staffed, some of these probably letters aren't going out, and they're going out to the wrong address and misdelivered or whatever, or you don't open, you don't understand it. Basically, if you're receiving surviving spouse benefits, widow benefits, whatever the case may be, and your benefit on your own record is more, each Social Security office gets a list, and then they send out letters and say, hey, there's more money on your own record. You have to file a claim. You have to actually call us up so we can take a claim and switch you to your own record. They don't do it automatically. So a lot of people miss those letters, and they don't know. So I guarantee there's thousands of elderly people out there struggling who have extra $200, $300, $400, $500, $600 sitting there waiting for them every month that could really use that benefit. So how do you help those people? You take that information and you go around and ask people, hey, are you receiving survivor benefits? Or you like, share, and subscribe and all that kind of stuff, so the YouTube algorithm goes out to more people and more people get help. All right, so we've got a lot of people speaking of supporting the channel. We got Linda became a silver member, Jerry became a silver, Sarah silver, Leanne silver. Thank you. Toby became a gold member. You guys are awesome. Thank you so much. And yes, people are putting in the chat, but HR 82, which is the Social Security Fairness Act that was just signed by President Biden a few weeks ago, supported bipartisan support, supported by President Trump. Not really by me, because I don't think it's fair, but anyway, it's a political thing, but it has been passed. So the problem is that the politicians, as usual, told Social Security, hey, here's 3 million recalculations you have to do, and we're not going to provide you any resources to do it. We understand you're 50-year low in terms of staffing, but tough, deal with it. And the people that are having to deal with it are the people waiting for those benefits. So I'm going to, we'll go into a Q&A now in about an hour or so, because this is brand new news that's come out. I'm going to do another live in a few hours, and we'll talk about the weapon, the GPO, and the HR 82, and how to make sure your claim is adjudicated. And we're going to talk about all the people that are probably going to be losing benefits because they don't know they need to do something. So we'll go over all that in a couple hours here. All right. But for now, let's go ahead and check out your questions. Travis, getting married in the Philippines to a single mother with minor children. Are the children eligible for dependent benefits? Do I need to legally adopt them? Can I file in the Philippines? Each country has what's called a totalization agreement with the United States, and each of those totalization agreements are a little bit different. So the Philippines, whether the U.S. citizen or green card holder, they have to have some type of legal status in the United States, and I think in the Philippines, but you needed to call the Federal Benefits Unit in Manila to check it out. But normally, if you were in the United States and you married someone and you had stepchildren, if you were providing those children with half support, and so half support, whatever financial support in the family, half of that has to come for you. If you're able to prove that, then normally children do receive benefits from the step parents. So. All right. Starting the week of February 24th, SSA is beginning to pay retroactive benefits. Okay, yeah, I'm going to talk about that. And starting a few weeks ago, they were supposed to pay retroactive benefits, yada, yada, yada. But that wasn't the problem. The problem wasn't the statement, or the problem wasn't we're going to do it. It's just the problem is we don't have the staff to do it. And so I'll talk about that in a couple hours. I looked at my Social Security, and it appears the payment at 69 years, 11 months is the same as 70 years. Yeah, it's not, though. It's a little bit more. Every month you wait, it's a little bit more, but you're only talking about 1 month. So, but the Social Security computer system, the online computer system, doesn't do well in calculating delayed retirement credits. So, but please do not wait till after you turn the month after 70. The month after 70, it's not going to increase anymore, so you're basically losing benefits. E. Smith, $9.99 for $9.99 donation support. Appreciate it. I'm getting Social Security and a VA check as a disabled veteran. Am I supposed to be paying taxes on my Social Security because of VA? Also, I'm a gold member on your. Thank you. Appreciate it. Your audio is going in it. It is? It's going in and out? Yeah. It was yesterday. Yeah, I had terrible audio yesterday, but hopefully it's better today. So yeah, taxes. Yeah, as everybody knows, I don't do taxes. I never worked at the IRS. But I put in the description, the YouTube description, the let me should double check. I put in the YouTube description the IRS link that you can go into the IRS website, click on that, and you answer like 5 or 6 different questions. You put in how much you're going to make, and it tells you whether you actually have to file taxes and all the rest of it, and whether you're going to be taxed on your Social Security portion. So. Let's see here. I asked last night, but had to hop off. Is it legal for my disability whole fight for benefits to be online? Your whole disability, but not sure what your whole life for benefits to be online? No, if someone, it looks like they changed it. I think they the Doge went into trying to save money, so they just taking their chainsaw to stuff, and they took a chainsaw to a company that was helping Social Security, update the system, make the computer system more efficient, and protect particularly your medical information. So it looks as they might have backtracked a little bit, and I would argue that perhaps the reason they did is because we talked about it and y'all called out and your politicians and say, hey, wait a second, we don't want, we've already got enough stuff on the dark web. We don't want our medical information and all the rest of it out there as well. So I think we accomplished that one. We need to know who to call right now to save Medicaid. They are voting today. Tell us who to call. Oh, you got it. Oh, let me go ahead and pop it up here. This is you call your politicians. It's not a state, issue. These are your federal politicians, your 2 senators, your House of Representative, congressperson. So that's the switchboard right there. That's the president. And then you go on to their websites and you go onto their social media and say, hey, what are you doing to protect Medicaid? And the distraction they will give you is, we're not going after Medicaid. We are just cutting fraud, waste, and abuse, which, okay, okay, perfect. But are they using that as an excuse? If you're going to cut fraud, waste, and abuse, you just don't say, okay, we're going to cut, 100 billion or 200 billion or 300 billion out of, Medicaid. And hopefully the people that are abusing the system, we hope it affects them. But there's going to be a lot of collateral damage. And because states receive a lot of those federal funding, and particularly the poorer states, they receive a lot of federal funding, and if they don't receive that federal funding, there's about 9 states that said, hey, if federal funding stops, then we're going to completely shut off Medicaid. So, fraud, waste, and abuse, then go after fraud, waste, and abuse. Don't just do, bull in a china shop type situation. And there's some other things that you definitely need to check out. What do these politicians do to improve the customer service and all the rest of it? Let's see here. Yeah, there's a lot of people about the WEP. I'm going to talk about that here in a little bit. And next couple hours, I'll come back and I'll do another live on that breaking news. I went disability last year. I had a features call, but Social Security didn't investigate all the years I worked. They just said it was 10 years, and then I got my benefits in 6 months. Yeah, if you disagree with your onset date that Social Security determines, it's based on your disability and when you file for those benefits and all the rest of it. If you disagree with it, then you file a reconsideration, an SSA 561, and you just say, hey, I thank you for the money, but it should have started 6 months before or a year before or whatever the case may be. But understand that, full disclosure here, they are reopening your case. You are asking them to reopen your case. So if someone goes in there and looks at this case, they're going to look at it from scratch, and they just might say, oh, why was this person ever approved? So you have to, bill today that affects Medicaid. Okay, yep, already talked about that. Let's see. I'm 57 on disability. Does my husband's income help determine my payment, and am supposed to report changes in his paycheck every 2 weeks? No, if you're just on regular Social Security disability insurance, then it's based on your work record, not on your husband's whatsoever. If you receive an SSI, which is the welfare-based program, SSI disability, then any money coming into the house does affect your benefits. But I'm assuming you're just on regular Social Security disability, so it doesn't affect it. Let's see. Oh yeah, somebody asked a question. Yes, and they were awesome, and support is paid $99. Let me think. He worked as a for the FBI or federal police. Um, Trying to remember, and then he worked for the Philadelphia Police Department, and he wants to know whether that new WEP GPO applies to him. And it really depends on how long he worked under the civil service. If it was the old civil service, it sounds like it was the old civil service that didn't pay into Social Security. All the federal employees that started work basically since the 1980s pay into Social Security. But if you were part of the old system, then you didn't pay into Social Security. So whatever pension you receive from that is affecting your pension, is affecting your Social Security based on your, what you paid into Social Security. So it just might. It really depends on how long you worked for each of those two entities. Um, and so I would definitely call Social Security. If your benefits are already reduced, then you should be good. It's automatic as soon as they get to you, the increase. But it's probably a good idea to make sure your address and your phone number updated in the system. And if you have a spouse or a divorced spouse or something like that you're looking out for, then they might receive extra benefits because your PIA, your benefit amount, is going to go up. So maybe you might want to reach out to them and say, hey, remember you tried to file for benefits on my record that one time and they told you there's no benefits because the calculations were wrong. Well, they're redoing the calculations, so it might be right now. So tell them to reach out and start that process. Thank you for reminding me of that. I appreciate it. Thank you. I have to wait until my ex-spouse is 62 to collect spouse benefits. Yes, that is correct. And you do not have to wait for your ex-spouse to receive benefits, to start receiving benefits, because maybe they're going to wait till 67 or 70. So their benefit amount has to be less than yours, less than half of yours. And you have to be final divorce for 2 years in order to get, it's called the independently entitled divorced spouse benefits. And one of the problems is when you go to the Social Security Administration and you talk to those frontline people that are not experts in, retirement, they're just, generalists. I've seen some office send people away and say, no, you can't file because your ex has to be receiving benefits, and tell them, well, that's a nice opinion. I would like to talk to a T2CS, Title II of the Social Security Act, which before I became manager, I was a Title II claims specialist, claims representative. So just said, hey, yeah, okay, I like to talk to a T2CS, and then they'll put you on the board or whatever the case may be, and you talk to the person and say, oh yeah, no problem. Yep, independently entitled divorced spouse, done a bunch of them. Nobody likes doing them because they're manual in the system and they're kind of a nightmare, but that's not your issue. That's the Social Security employees' issues. Okay, this is another GPO type question. So I'm gonna, like I said, I'll come back in a couple hours and do all those. My wife worked 40 plus years, passed away from cancer. Wow. Sure would be nice to get some of that money that she left behind. Yeah, if her benefit amount is higher than yours, then you can definitely get the survivor benefits on hers. Or if you're, approaching 60 years old, you can file for benefits on her record and then delay benefits on yours. But yeah, people that, pass away or something and, there's nobody to pay, then that's the social part of Social Security. Let's see here. I'm 62 with a chronic disease and mental issues. If I could work, I would work, but my body won't allow me to work. Will Social Security disability allow me to be retired at 62? You can, if you have a disability that you can't work because of it, you can collect disability anytime if you're approved for it. So yeah, if you're unable to work because of your disability is going to last 12 months or longer. Obviously, chronic means that. Then definitely call Social Security, set up an appointment, or you can go online. I've done a few videos on the disability process, on how to file it, and tips, tricks, and secrets. So watch the videos. I've got like 1,000 videos, but just check out the ones I did, a series of 3 videos on filing for disability benefits. Let's see here. Peggy, what's up, Peggy? I received a letter from Social Security said they discovered they weren't paying me enough. Oh, we liked all to get those, right? They increased my, oh, okay, perfect. So it looks like they, whatever calculations, they found some old earnings or whatever the case may be. That's a beautiful thing. Wish we'd all get that, right? I'm 70, have Blue Medicare Advantage. My benefits are 14,000. A friend told me I can get my Medicare for no cost. My premiums are 2,000. Is that right? That can I get my Medicare at no cost? Possibly. Your benefits are 14,000, so that's under $1,500 a month. So it depends whether you have any other income or resources. They're talking about the Medicare Savings Program. And the Medicare Savings Program is through your state. You apply through your state Department of Social Services, Department of Welfare for Medicaid. And that's the one that's kind of under attack right now. But you apply for Medicaid, and if they approve you for Medicaid, and yes, Medicaid is an income-based resource, means tested, low income, low resources. So if they approve you for Medicaid, then they just might pay for your Part B. Each state is a little bit different in what level you're approved for. But if you're approved for the higher levels, then they will pay for your Part B premium, that $185, and then you will be able to get a different type of Medicare Advantage plan. It's called a Medicare Advantage dual eligible. Dual because you're eligible for Medicare and Medicaid. And those dual eligible plans are those ones that you see all the time, that are, all those grocery cards that are advertised kind of in a, scammy way, but they do exist. But it really depends whether it exists in your particular area, in your particular zip code. And again, you can reach out to, I'm always bad at this. You can reach out to chapter there and they can find out if you're eligible for one of those plans, and they can help you through the process of applying for Medicaid. They can tell you how to do it and all that kind of stuff. And this is also the open enrollment period. If you have a Medicare Advantage and you're this time, January, February, March, and you want to switch your plans, throughout the year, if you have like a special enrollment period, you move or you're receiving a dual eligible, you might be able to switch. There's different times you can switch your Medicare Advantage, but this is definitely one of those. January, February, March, you can switch your Medicare Advantage plan to another one. If you forgot to check your Medicare Advantage plan in October, November, then you have a do-over. You can do that now. If you've, just get a new doctor, or you just were told by the doctor that you're going to need to be in the hospital or something, maybe it's a good idea to reach out and again, reach out to chapter, and they can see if there's a better plan in your area. 100% free, and they support our channel and make sure we are able to help you. So if you switch your plan now, it's the end of February. You go to a new, and another thing is you can get out of a Medicare Advantage plan now. You can get out of a Medicare Advantage, return to original Medicare, and get one of those Medicare supplements, the Plan N or the Plan G. They do come with a monthly premium. That's why a lot of people don't get those. But over the long term, if you get sick, it's usually cheaper. Depends. And no networks, no prior authorizations, but you just might have to go through health and underwriting in your particular. It depends on your particular state, how your state, regulates that. Just because of moving from Alabama to Texas, when Alabama said I would get a raise when I changed to retirement, which I didn't, and they changed it without my decision. Yeah, I'm not sure. Social Security is a federal program, so yeah, it doesn't matter where you live. There's some states that give you an extra money on top of your SSI, supplemental security income. But in terms of, Social Security, retirement, disability, doesn't matter where you live. Yeah. Thank you very much. Let's see. Scary times. The Office of Transformation. They got 30 days of admin leave. Do you think us BAs, CAs, CSRs, the PC are safe? Yeah, the BAs are benefit. The benefit authorizers, the CAs claim it. Yeah, so CSRs, customer service representatives. I'm starting to lose my acronym knowledge there. BACAs, claims authorizer. Yeah, wow. That's one of the things they've been talking about for a long time is the consolidation of the 9 regional offices. So perhaps that might happen. But this is they're closing down offices, and because they're say it's redundant or whatever. Okay, fine, perfect. Okay, whatever. And not sure about that particular office, but okay. But don't put these people on admin leave. Don't fire them when there's a 3 or 4 hour wait for the phones, and people are having to wait for months for their retirement benefits to be, decided and approved and get their checks and disability. And come on, and just like, okay, hey, we're going to close down your office. Go answer the phones. It's crazy. Yeah, like Timothy waiting on my check, right? So the people in this particular office can go help get your check. Yeah. The Social Security Administration will still perform a CDR to review my disability. I'm going to talk about this week in the next few days. I'm working on a video now that's because that's one of the big targets: Medicaid and disability, SSI as well, supplemental security income. Those are going to be kind of the ones that are, what this channel talks about. Those are going to be definitely the ones that are going to be looked at. And so I'm going to do a video on disability, and make sure you're protected. So please watch for that one here coming soon. Let's see, Kathleen. I was on SSDI, but recently turned 65, and now I am supposed to get retirement. Now what else? No, it happens at your full retirement age, and 65 is not your full retirement age. The only so once you hit your full retirement age, 66 and 8 months or 67 or whatever the case may be, then it's switched from disability benefits to retirement benefits. But your check stays the same, direct deposit stays the same, and everything. Most people don't even realize the switch. But you're no longer limited to how much you can make, and you no longer have those continuing disability reviews. But one thing you do need to do at 65 is, up until now, when you're on disability, probably the only thing you could get was a Medicare Advantage plan. But now that you're 65, you cannot be denied a Medicare supplement plan. So at least check it out and see if it's right for you, in terms of budget and everything, because this might be your only chance to get a Medicare supplement plan. Did you see where they are closing the Vegas Social Security office? I haven't seen that one. That's one of the busiest in the country. There's a few retirees in the Vegas office. Let's see. I have to check on that one. I haven't heard anything about that one, but wow, stuff is happening fast around here. I think that's that's the strategy. I'm getting ready to be 62. I'm on X's survivor's benefits. Is there anything I need to do? Check to see if your benefits on your own records. So you're already receiving survivor benefits, and you started that a year or 2 years ago, whatever the case may be. Check to see if your benefits are on your own record or more. If not, just keep on keeping on. Stay on survivor benefits, and then when you call up Social Security and say, hey, how much is the benefits on my record at 62? And they'll say, well, how much is it going to be when I hit my full retirement age, 67 or whatever? And they'll tell you, and if it's going to be more at 67, then you say, okay, we'll talk to you again at 67. So no CDR review as of yet. I am 44 now. Again, I'll talk about that here pretty good. Only one in Vegas. I think the others are technically Henderson. Yeah, no, there's one in North Las Vegas, and there's one in Henderson, and the main one is in Vegas over there on Buffalo Drive. I am developing cataract on my eyes, and I explained to the agent that they said, sorry, we can't help you. This was last year. Medicare doesn't do cataracts, but there's I'm almost sure they don't, because that's operation to fix that. But well, I guess there might be exceptions on that one, usually not. But I'll take that back. There's a great app that Medicare has. Go on to Medicare.gov, and the app is called, Is It Covered? And there's an app you can download on your phone, and you can type in everything under the sun, cataract surgery, and it tells you, whether it's covered and how much you have to pay and all the rest of it. So, that's a great app. Elon Musk, if you want to make Social Security more efficient, that is definitely one thing, you can do, except for, going out there and pretending there's dead people that are 150 years old collecting Social Security benefits. I talked about that yesterday. If there is, why haven't you stopped the benefits payments yet? And why haven't you prosecuted these individuals? What's going on? Because it didn't exist. Anyway. My understanding for SSI is to maintain retirement year best. And how is SSI at risk with the Doge? As a permanent disability with SSI. Love the Ikigai segment. Yeah, Ikigai. Yeah, your philosophy of life, I guess. So what gets you up in the morning? What makes you motivated? Ikigai, Japanese term. Mine is this. Every time someone pops up and say, "Yeah, I just helped a friend down the little old lady down the street get a whole bunch more money, so she's got an easy." That's my Ikigai. But yeah, SSI, in the names under the ruse of fraud, waste, and abuse, which is always a beautiful thing. I think that's really going to be, targeted over the next few months. And again, it's with a broad stroke, and unfortunately, a lot of people that are going to get caught up in it. I received a letter 2 years ago saying that they miscalculated my retirement by $25. I got the increase, but didn't receive the back payment. All right. So yeah, I would definitely reach out to them and say, hey, you miscalculated 2 years ago, and I've been receiving benefits for the last 2 years. So I should get 25 times $24, right? Joan Lawrence donated. Thank you very much. Scott from South Carolina, $10. My brother-in-law, 61, needs to file for disability. What are the steps? Has dementia symptoms. He hasn't worked in years. Okay, so if he hasn't worked in years, for Social Security disability, there's two insured statuses. That you're insured for disability, just like retirement, 10 years, 40 quarters, and all the rest of it. But there's also currently insured. You had to work any five out of the last 10 years. So if he hasn't worked in years, 5 out of the last 10 years, then he wouldn't be eligible for disability benefits, but still file because he just might be eligible for SSI benefits, the supplemental security income. Anytime you file for disability benefits, they always check both programs. You take your disability claim, and they also ask you questions about your, income and resources to see if you're eligible for SSI. But if he is unable to do it, with number one from Scott from South Carolina, thank you for taking care of your brother-in-law. Awesome. That's what we like to hear. You can file for him as a representative payee. Help him go through the things, and that way, if they call, if they have any questions or something like that, they can reach out to you as the representative payee. And probably the best thing is just go ahead and file online, possibly, or call the 800 number if you want to talk to a human being. But do it as soon as possible, particularly now, because it's the end of the month. Contact Social Security now, today. Run to the phone, because that protects you for this month. If you wait till March, he might lose a month of benefits. So it's important that you reach out to Social Security. Too many people are, well, I'll go ahead and file for, disability benefits, or I'll file for divorce spouse benefits, next month or 2 months when I get this, document, or this birth certificate, or that marriage certificate. No, don't do that. You're losing money. Contact Social Security, reach out to them. That protects you for that particular month. And then start getting whatever documents you think you might need. So get all his doctor's names, the doctor's phone numbers, addresses, when he saw those particular doctors, when he went to the hospital, when he went to these clinics, when he had this particular test. Get all that information. Get his prescription bottles down there, line them up, and you can go online and fill it out online, or again, schedule a phone appointment. So. There's the question from yesterday. Philly PD did not invest in Social Security. I retired from Philly PD and joined the Federal Bureau. Okay, yep, I answered that one. So, welcome back. Sorry I couldn't get to you yesterday. How do you know? So I answered your question about 10, 15 minutes ago. So, if you're, once we're done here, just review the video. And I answered your question right after I finished kind of today's topic. So how do you know if you qualify for spousal benefits? For current spouse benefits, have to be married to the person. If you're currently married, you have to be 62. And if you're currently married, that person has to be receiving benefits. If you're divorced, not necessarily so, but your current spouse has to start benefits, has to be receiving benefits. You're at least 62. and then the calculations. Your benefit amount, your full benefit amount has to be less than their full benefit amount in order to get those benefits. All right, let's see. I am receiving my husband's benefit. Oh, and you also have to file for benefits on your own record first. So you file for benefits on your own record first, and then if the numbers work out, then yeah, you can collect those spouse benefits. Donna, I am receiving my husband's benefits. He passed 7 years ago. I watched you then say I should wait until I'm 70 to get the most out of my own Social Security. Is this still true? I won't be 70 for 3 more. Um, it really depends. So you're receiving surviving spouse benefits. So, okay. So you're receiving spouse benefits and you never touched your own. So, yeah, if you never touched your own, never started your own or something before he passed away or something, then your benefits are continuing to increase. I would call Social Security in your particular case because you got 3 more years and, call up Social Security, sit on the phone for 3 or 4 hours. And while you're waiting on hold, reach out to your politician on their website and say, hey, how come I have to wait for 3 hours to get an answer? But yeah, call Social Security and say, hey, how much is the benefit on my own record? And then say, how much is it next year? And if it's more, go ahead and jump on it. Let's see. Laura, Dr. Weir, I'm 57 on disability. Okay, I already answered that one. I was drawing SSI because I'm disabled, but when my ex-spouse passed away, I lost my SSI disability and only draw his SSA. Should I still be on disability or just Social Security? Yeah, basically you lost, you might still be disabled, but you're receiving a different type of benefit. Your SSI, because SSI is a welfare-based program, and the max you can get on SSI is $967. So you might still categorically be, categorized as disabled, but you're just not receiving SSI because you're getting too much on surviving spouse benefits. So, all right, a lot of people asking questions about the new WEP, and for those that showed up late, in the next hour or two, I'm going to come back on and I'm going to talk about that new news that went out about the Social Security Fairness Act. If you decided to use Part B and are working, giving up the work health benefit, then realize that work plan was better deal. Can you go back to using the work insurance and quit the Part B next year? Yeah. If you have, if you're 65 years old and you go ahead and sign up for Part A and Part B, and then you get a job a year later, 2 years later, 3 years later that has health insurance from work, then yeah, you have credible coverage. Then you can return to that. Yes. Common law, marriage, how does that work or not work in the context of Social Security? Social Security goes by state laws. So in whatever particular state you're looking at, in whatever particular time, because some states have changed over time, but if your particular state recognizes common law marriage, then Social Security recognizes common law marriage for that particular state. And don't do your research on this necessarily, all the details. File for benefits because the Social Security Administration, in the 20,000 pages of policy, PALMS policy, it's called, it has all of the states that recognize common law marriages and all of the states, what type of documentation you need and all the rest of it, what years. And so, yeah, they'll do all that work for you. Laura, thank you for helping so many people get the most out of their benefits with your unending knowledge. Appreciate you much. Oh, wow, thank you very much. That's my ikigai right there. Doc, how come disabled or disability don't file taxes? Yeah, again, if all you're receiving is Social Security benefits, then people don't pay FICA taxes or Social Security taxes on their Social Security benefits. And again, go into that link I put in my description in YouTube where it says specifically, whether you do have to file for taxes. Because there's also, other categories, do you get an earned income tax credit? And this is federal taxes. So even if the IRS says you don't have to file taxes because you don't make enough or whatever, your state might have different ideas. So. Hi, I'm on SSDI, and my question is, can you buy a house on SSDI? How will the Doge give checks to SSI? Okay, yeah, if you're on SSDI, do whatever you want. No issues whatsoever. If you're on SSI, supplemental security income, the welfare, that's, if you got money to buy a house, then, there might be an issue there. You're actually, if you're on SSI or any type of means tested program, Medicaid, food stamps, SSI, they exclude one house and one car. So, one car. I've had people contact me and says, I've got a car and I've got a broken down car that's still registered in my name and blocks on blocks of my front yard, and they were denied because of that, because another car was registered in their name, and so they were it took them months to get that car out and unregistered in their name. So why are the age of 70 and still working, you still have to pay into Social Security and your benefits will not be increased? Yeah, you have to pay into FICA tax forever. Unless you're super rich, in which they don't pay into Social Security tax after $176,120. Yeah. Anyway, but your benefits just might be increased. If you're 70, 80, 90, 100 years old and working and paying to the Social Security, and that year of work is one of your high 35 years of earnings, then yes, your benefits will increase. But if it's not, then it won't. So. All right, let's see what I am 57. I'm on disability. I divorced from a 30-year marriage. I cannot seem to get any more benefits. Why? And also, I am deemed disabled through SSA since 2019. Where do I go from here? So if you were married to that person and just the numbers don't work out in terms of your benefit amount is not less than half of that person's, I guess him, then no, you're not entitled to benefits while that person is still out there alive and kicking. Survivor benefits, remember, are calculated different. So if that person's benefit amount is $1 more than yours, when that person passes away, then you're entitled possibly to that extra dollar. Depends on how long you were married and all the rest of that stuff. So after Social Security processing your application and you start receiving payments, can they inform you that your payment should be less? Yeah, if there's a mistake and they need to correct it, always be careful of when you file for Social Security benefits and the person, if yours is a pretty easy case, and I'm sure people, what do you mean by easy case? If you're just just regular retirement on your own record and stuff, it's usually an easy case. But if you have something, your earnings record is incorrect or something, particularly survivor benefits and spouse benefits. If someone tells you, the Social Security employee tells you at your interview how much you're going to get, say, okay, well, thank you, but the final decision doesn't come until they print out the decision letter, the award letter, and you get that decision letter, and it'll tell you exactly how much the benefit amount is. And people say all the time, "Well, I was told I was going to get $1,500, but I'm only going to get $1,497." And you can dispute that if you want, but sometimes the claim specialist, before they do the actual final calculations, they start giving out numbers, which I don't think they should do, because it just freaks people out. So, but sometimes something happens later and they make a mistake of the calculations, and yeah, they have to fix it. That's why the number one thing of Social Security employees is they don't want to make a mistake. And you're saying, well, that happens it happens all the time. But Social Security employees hate making mistakes, because when you're hired by the Social Security Administration, they tell you a whole bunch of things, but one of the things they tell you is it's going to take you 10 times longer to fix a mistake you made than doing it right the first time. So take your time, do it right the first time, because if we find out, the claimant comes in and says, "Hey, I'm getting the wrong benefit amount," we're going to make sure you're the one that fixes it, and then we're going to have it reviewed by a technical expert, and that's going to take 10 times as long, and you've already got 400 cases on your desk. And so, yeah, Social Security job, their number one job is to make sure they don't make mistakes, because it just makes their life 10 times harder. If you don't want to see some of the trolls comment, okay, trolls, yeah. I'm new here. Hey, Joni, welcome. I'm 64, receiving Social Security. If my younger husband carries me on his health insurance, am I able to stay on that, or must I sign up for take Medicare? No, if you're married, your spouse is receiving health insurance from work, and that employer has 20 or more employees, then nope, you do not have to sign up for Medicare. You don't have to notify, Social Security that you don't want it when you turn 65, unless, well, you are receiving Social Security, so you do. So because you are receiving Social Security benefits, about 100 days before you turn 65, Medicare will send you your package in the mail with your Part A and Part B. They will sign you up automatically. So at that time, it'll give you instructions on how to refuse Part B. So if you still have health insurance from your spouse's work and 20 or more employees, and some employers, they want you to sign up for Part B because it helps save them money. So I would reach out to that person's employer and say, hey, do I have to sign up for Part B? Or if your younger husband's um, plan is not that great, maybe next year it turns into a terrible plan with high deductibles and stuff like that. So you want to compare. But if it's a good plan, you're happy with it, then yeah, refuse Part B. Don't waste your money if you don't have to. Ash, $1.99, thank you, appreciate it. You guys are awesome. Can you explain if my spouse Social Security income is higher than Social Security income, can I receive his Social Security income instead of mine? Um, his benefit amount has to be twice your full benefit amount. Your full benefit amount, his full benefit amount, not how much you're actually receiving, but the full benefit amount. If you each had waited till your full retirement age, his has to be over twice yours. And you cannot switch. You can add that benefit on top of yours. You will continue to get your benefit amount, and then you just might be able to add that extra money on top. So let's see. Okay, already. Let's see. Hey, this is Bill. Why do I get a minimum of 10 calls a week? Some say healthcare and local numbers from other countries. What's up with this? Yeah, it's Medicare, CMS, Center for Medicare and Medicaid Services, that Dr. Oz, I guess, is going to be in charge of here soon. And starting October 1st, they were supposed to stop this. If for these Medicare companies and stuff, what happens is if you touch you click a button on Facebook and you have this one person from Topeka, Kansas, you say, hey, I want to talk to you about, Medicare. And then, you talk to them about Medicare, and it turns out, okay, never mind. I don't want it. I don't like that plan, or whatever the case may be. What has been happening is that company or that person sells your information, for $5 or $10 or $50 or whatever to this person, and that person sells it to another person. And, and then everybody in the country has your phone number. But starting October 1st of last year, they're supposed to stop. They were theoretically supposed to stop that. If you gave that person permission in Topeka, Kansas to call you, then that is the only person that's supposed to call you, that person or that particular person's company. Those are the only people that are supposed to call you. Nobody else is supposed to cold call you for Medicare, because the Medicare sales is crazy regulated. You walk into a mart that will not be named, and you see a table there and it says, ask me about Medicare. And the person is just sitting behind the desk, just sitting there, staring at the ceiling and stuff. And you're like, wow, that person is a terrible salesperson. They ought to be out there, shaking hands and stuff. They're not allowed. They cannot talk to you basically until you start talking to them. That's why the sign says, ask me about Medicare. They're regulated. If they stand up and start walking in the aisles or say, hey, how you doing? Do you have Medicare? That's it. They can lose their license. So that's how regulated it is. But there's always bad actors. And that's why I picked chapter there, is because if you don't call them, they ain't going to call you. It's, so you have to call them. Let's see here. Hello. I have a problem which don't understand. Everything has come up and fast, and I can't keep up with what's really happening. I got my retirement. Great. Okay. Not so fast. Okay. Not sure where that's going. Ash, thank you very much. Great program that you have here. I appreciate it. I'm 63 years old and have been receiving Social Security disability. Do I have to convert to regular Social Security benefits when 65? No, not if you don't want to. Most people don't. You just you just keep on keeping on. Once you hit your full retirement age, 67 or whatever, then your disability benefits are converted to regular retirement benefits, but the check stays the same. Most people don't even notice. It's more of a bureaucratic thing. They stop taking your money out of the disability trust fund, start taking out of the retirement trust fund. So, but if you are, again, once you reach 65, that is one thing you definitely need to check out. If all you have available in your state is a Medicare Advantage because you're on disability, 65, they cannot deny you. So when you turn 65, it might be a good idea to check to see if a Medicare supplement plan is best for you. All right. So, hey, Joan, thank you very much. Appreciate it. Let's see. I was diagnosed with lung cancer in 2016 and never collected disability. And I'm now 62 and collecting Social Security. Am I allowed disability benefits retroactively since I did not collect at all? It really, again, depends on your work, whether you're currently insured in the sense of that you worked 5 out of the last 10 years. And sometimes it's hard to calculate, oh, well, is this considered 5? Just let the Social Security Administration do it. You call up, I would schedule an appointment and file for disability benefits, and they will do the calculations and determine whether you're currently insured. You are insured because you're receiving, retirement benefits, but whether you're currently insured in terms of disability, that's a whole different thing. Or you can file online and they will do the calculations and they will let you know. So maybe you can, go back retroactively and say, hey, I became disabled last year or 2 years ago or 3 years ago or whatever the case may be. So again, I would reach out immediately, if not sooner, and get this thing started because it takes way too long. So less than 500 likes. Like this life. Yeah, come on, people. Like, subscribe, all that kind of good stuff. I received an email on my Social Security account today about the Campos case. Do you have any info? It's regarding overpayments that maybe shouldn't have happened. Yeah, there's a lot of different court cases, Goldfield, and if people sue the Social Security Administration because of calculations or those lawsuits or something like that, which is it's a beautiful thing. I mean, Social Security did something wrong, and the court said, okay, you got to go fix this. Okay, then. Takes a lot of resources out of the offices to do all this, but hey, I have to make sure we do the right thing. If you're part of that case, what will happen is if you got an overpayment that you shouldn't have received, the big thing, and this is a stimulus. I'll probably have to do another stimulus video here pretty soon. The Doge dividend, but the last time we got a stimulus, that wasn't supposed to count against your SSI, supplemental security income. And unfortunately, in some cases it did. So I think that possibly might be the Campos case or a similar one. But yeah, you just follow the directions and understand it's going to take time because there's probably one person in the state that is dealing with those particular cases. And they just have to go through it one by one and make sure everybody gets the benefits they're entitled to. So, but reach out to your politicians and tell them to support Social Security so all of this stuff can happen sooner and I can go back into real retirement again. So, which I never will, but anyway, I'm dreaming. All right, I am over time, an hour. We're out of time, but like I said, I'll be back in a couple hours and we'll talk about the Social Security Fairness Act, WEP, and GPO, and the stuff you need to watch out for. Y'all have an awesome night, and please take care of each other. Bye-bye.